Hey guys, it's Nurse Gwen. Let's talk about hemolytic uremic syndrome, or more known as HUS. This is most commonly caused by the Shiga toxin caused by an E. coli infection, and we see this most often in kids under the age of 5. They present with a typical gastroenteritis clinical picture. They've got nausea and vomiting, kind of some lethargy, they just feel like garbage, but then about a week after the onset of those initial symptoms, they can start to get much more sick. They're going to present with hematochezia, and on their lab work, you're going to see thrombocytopenia, so a low platelet count, and this is going to be related to that hemolytic anemia. Those red blood cells are rupturing due to that Shiga toxin. Well, those blood clots that form because of those broken down red blood cells and then the platelets that aggregate around it cause microemboli, particularly in the glomerular, that's a really hard word to say, glomerular microvasculature, causing renal damage. So these kids will present with an acute kidney injury. They'll have an elevated creat level. They might be in a fluid volume overload status because their kidneys aren't filtering anything out. And it's got a really high mortality rate on it, 10%. If that was my kids, I would be super worried if they had something that was a 10% mortality rate. So your lab work, you're gonna see a low platelet count, elevated creat, you're gonna see an anemia on these kiddos. I flew a toddler with this a few years ago. I had never heard of it before then, and I thought for sure by looking at the lab work that this kid probably had an undiagnosed leukemia. Turns out it was just hemolytic uremic syndrome. So what are we gonna do about it? Well, first off, you need to know we are not giving these kids antibiotics. That can actually make this a lot worse. It will increase the toxin production from that Shiga, from that E. coli. So we do not use antibiotics on these kids. As a matter of fact, that's why we don't just standardly use an antibiotic in any kind of run-of-the-mill gastroenteritis, because it can increase the risk of hemolytic uremic syndrome. So our treatment is mostly supportive. This is pretty self-limiting as long as these kids have this supportive therapy. They may require a blood transfusion. They're gonna need a lot of fluid administration. In more severe cases, they're gonna need renal replacement therapy, so temporary dialysis. And for the most part, we just need to monitor these kids and give them that supportive therapy. So I hope that helps you understand hemolytic uremic syndrome.